Welcome back to our Unclenched podcast. Today we have a very special guest who I work closely with for several of my TMJ patients. I'll introduce him in just a moment. Before we do that though, let's catch up. Alex, how have you been and what's new with you?
Oh, I've been good. Working away and a little bit of fun stuff going on. We went to a fundraiser and typically it's like, oh God, another fundraiser. But let me tell you, this fundraiser was in this guy's backyard, okay? And he's got a big backyard. But, you start out with hors d'oeuvres and drinks and this and that. And then there's a stage. And out comes Smokey Robinson singing to us in this guy's backyard. Oh, no, wait, it gets better. It gets better. So,
What?
yeah. So, then after that, there was another like local jazz band. And then the headliner, Pit Bull, in this guy's backyard.
Pitbull?
Pit Bull.
I love Pitbull.
Pit Bull. And then fireworks and stuff. It was just like,
What?
oh my God, I know.
Mr. Worldwide.
I know, right? So that was my fun. That was my fun.
I am here for it.
Yeah, it was great fun. So those of you that listen regularly, we always start out too that I always got to bring up a patient that I got stuck on or someone new to my practice or something like that. And this is an interesting patient. She came to me with what is an open bite. So her front teeth didn't come together. The only place she touched were on her back molar on this side and back molar on this side. And for 20 years, she's been wearing an appliance. And I'm like, okay. And when she puts the appliance in, that's what kept her jaw so open. So not only did it keep her jaw open, so the point is the wrong appliance can be very, very wrong. So not only did it keep her jaw open and like her tongue could just protrude right through that area. And she like couldn't bite into a sandwich because her teeth didn't touch in the front. She couldn't, bite into an apple or anything because her teeth couldn't come together to pull the apple apart. So we're going to fix her though, because I've seen patients like that before, and we're going to get her a bite first of all, where she can bite a little bit more evenly, and then we'll start moving her teeth and bringing her maxilla together and down. But so that's an exciting one. And I love the ones where I'm like, oh my God, because I love at the end when I'm like, oh my God, this turned out great. So
I love that.
I'm ready to tackle her, but the appliances, if they're wrong appliances for you, and yet I don't even know why she wore it because she was in pain all that time. So it's like bizarre to me, but she's the type of person, like you tell her what to do, she's going to do it.
Yeah.
So her doctor said, just keep wearing this appliance. And that's what she did. So I hope she listens to me when we get her therapy going. Oh, she will.
Yeah, she will, because you're going to get her feeling better.
Yeah.
And if she listened to someone who is making it feel worse.
Right. Yeah. And if she doesn't, we'll just take her out back and beat her up a little bit, and then she'll listen, right?
Take her out back. I love it.
So what's going on with you, Priya?
Oh my gosh. The kids are so busy with summer camp. So I don't know when this is going to air, but right now it's summer and I cannot even keep up. I didn't go to any summer camps. I just stayed at home and read books. And so it's like
that's why you're so smart.
I don't know about that, but gymnastics camps, swim camps, equestrian camp. Like, wow, these kids are so lucky. And I tell them to be grateful and write down things they're grateful for, like at least once a week. So, but it's keeping us busy for sure. And then I know we always talk about a patient that stood out to us. So I had a lovely lady named Jody. Her concerns were ear pain, sinus pain, off balance sensation with heart palpitations, chest pain, sore throat, headaches, and neck pain. Everything is resolved. She is feeling so much better. She's been in treatment for probably like 5 or 6 months, and we're getting close to the end with her. But it's just so gratifying to see people go from being really debilitated and having a low quality of life to enjoying life again, enjoying eating, enjoying going out with friends. I mean, this can be so debilitating. TMJ can be so debilitating. It can keep you from doing the things that you love. So she really like stuck out to me, and she's just so sweet too. So but yeah, let's go ahead and bring on our special guest. Today we're going to be talking to Dr. Corey Burt. He's an upper cervical chiropractor who practices in Beaverton, Oregon. He has quite the social media presence, especially on TikTok. I think he even did like a rap on there, which is really fun. Sorry, Corey.
I'll
Had
have to look that up.
Yeah, I'll send it to you. So more specifically, Dr. Burt is a NUCCA chiropractor. NUCCA stands for National Upper Cervical Chiropractic Association. So welcome, Dr. Burt.
Awesome, Dr. Mystery. Thank you so much for the introduction. And yeah, you don't want to
Yeah.
hear that rap. Don't send it, please.
Oh, okay. I'll just send it to
No,
Alex.
you can send it. I'm joking, by the way.
Okay.
I'm very
Um,
sarcastic. Sometimes I got to be careful with my sarcasm with patients, but yeah, you can send it by all means.
so
But
good. I loved
you
it.
might have to.
Um,
Thanks.
well, why don't you tell us a little bit about the very specific type of chiropractic care that you do and what got you interested in this? Tell us a little bit about your journey.
Yeah, absolutely. Happy to talk about this. And, I think upper cervical chiropractic is one of the best kept secrets. And really, we'll get into all that. But first, I do have to thank you, Dr. Mystery, like for all your efforts and, building this platform and educating people on just the TMJ. And I'm really inspired by your movement that you've created and just really helping those that are suffering with this. And so I'm happy to support this movement that you've created. And I'm telling you, I mean, you know this, but you're changing people's lives forever. You shared one story just earlier. I mean, there's so many more. And so I'm just very, very happy and thank you because we're all on
Thank
the same
you.
team,
That's so kind.
different niches. But yeah, and for all your listeners, like these specific jaw appliances that Dr. Mystery customizes, and you're correct, Alex, like certain dentists do them wrong. And there's a right way to do it, and you two do it right, and they work well, and it's just, and I know this because I ask the patients who you send over, Dr. Mystery, and as they go through their treatment plan with you, it's a wonderful system, and you've got it down to a T. So, anyways, I just had to put that out there, and
Thank you.
I'm happy to go ahead. Yeah, it's just I mean, you're too humble about this, so I appreciate that, but at the same time, you're doing wonderful work. So.
Thank you. My husband would never call me humble, but
Ah,
I'm going to tell him you said that and be like, look,
hold on.
I'm not even being humble about being humble. That's what's funny is what he's going to say. But go ahead. Sorry.
There's a good way to do it. No, you're all right.
Your story. I'm sorry.
But yes, in regards to me, people always ask me, why NUCCA, what is NUCCA? What is a NUCCA chiropractor? I'll put it out here real quick. And all you need to know is that a NUCCA chiropractor is a special type of chiropractor that really focuses on one thing only, and it's making sure the head is aligned over the neck. And so it's simple. We are really head and neck specialists, and that's where we devote our attention. Now, why did I become a NUCCA chiropractor? And it's a simple answer, right? It changed my life, and really it changed my wife's life before, and so that's what got me interested. But anyways, with me, I mean, it came with heavy weightlifting. I was a college athlete, and I had a lot of back, hip, and knee pain, and I tried everything. And really, the only thing that helped me was chiropractic, and it was traditional chiropractic, which is what I knew at the time. And so, of course, I wanted to help other athletes, and that's why I went to chiropractic school. It made sense. I was going to be a chiropractor. Now, meanwhile, my wife, she had migraines and jaw pain, and really frustrated me it not being able to help her. And she had seen chiropractors. We had this idea that chiropractic could help with these types of things, but it was frustrating because she couldn't get help. And even me, getting to chiropractic school, I tried to adjust her and give her some relief. And what did I know at the time? But it was challenging. Here I am learning to be a chiropractor, and I couldn't even help my own wife. And so, anyways, fast forward 6 months or so, the NUCCA Club on campus was talking about this special event that was happening. Some neck specialist was flying in, and so I registered for it. Didn't know much about it at the time. And fast forward, keep this short, but two fundamental concepts I walked away with. One if you're going to adjust someone's neck, you better take pre and post scans, or pre x-rays, pre-post cone beam scans, and really make sure that you help them, that you got to get that validation. And two, if you're going to adjust someone's neck, you better be gentle with it. The concept, lighter is righter. And so just, no
Like
twisting, cracking, or popping of the upper neck. That's really important. The upper neck's not meant to move like that. Now, mind you, I was really only thinking about my wife at this point, who was going to help her, and really, could NUCCA help her? And the short of the long is that it changed her life. She ended up getting the NUCCA adjustment, and 1 week, 2 weeks, 3 weeks went by, no migraines, no jaw pain, and so I was surprised, and yeah, I was shocked, but kind of angry. And of course, I was happy that she got some relief, but frustrated. Like, nobody had taught me how to do this simple style of chiropractic, this style of adjustment. It was random how it looked. But anyway, so it's like I had this idea going in, like some random doctor had to fly in from out of state to teach me this. It's like, shouldn't that be the school's responsibility? Anyways, there's different philosophies on that. But yeah, it was frustrating. And so, after I experienced this through her, I decided I should probably get my NUCCA adjustment. And, long story short, my life changed as well. And where I noticed it most was in the weight room. My back pain, hip pain, knee pain, it all went away. And it was interesting, like my bench press felt balanced, my pull-ups, it was really kind of an abstract concept, the squat. It was a unique in-tune experience just that I've developed as an athlete over the years. And I could tell something had shifted. So I knew there had to be something to do with the upper neck. And so I was convinced I couldn't go back and learn it the other way with the neck. I had to figure out, how do I do this right? And that was the concept through the rest of the years of the study at the chiropractic college. Like, how do I become the best neck adjuster? And so NUCCA, that's where I was led, and just a lot of mentorship over the years, continue to use that. And that's really what I've committed my life to doing.
Wow. Wow, that's great. I mean, that kind of correlates how I got into TMJ too. It was kind of a fluke, and then once you see it, you can't unsee it. You can't go back to your old way of training and your old knowledge. You just got to still kind of push through and go forward. So, what is the correlation, according to you, because we get this question a lot, between TMJ problems and upper cervical problems? So can you explain a little bit about that?
Yeah, I was curious at the time as well. How could someone get a neck adjustment and get jaw pain relief? And, actually, I should say this. Well, get a NUCCA adjustment and get jaw pain relief, because she had a lot of other neck adjustments that just didn't really help. So yeah, how does this all make sense? And we'll keep it simple. The summary is this: when the head and neck is injured, it's very common that the head will misalign over the neck. And you can visibly see this on people. I spend hours walking through the mall, looking at people. And no, I'm just kidding. I actually don't. But you can see this on people, and you'll learn pretty quick, who's had neck trauma in their lives. And again, why does this all matter? Because people with head tilt commonly have TMJ problems. And so that's what I really do, and analyze what is the head doing. And if you have head tilt, your upper teeth will not line up with your lower teeth. And so over time, the jaw muscles will become imbalanced, and they'll tighten, trying to protect the joint, TMJ and other muscles of the head, neck, and face. But that could make you clench more, which could lead to TMJ pain. So in a perfect world, your head is aligned over your neck, and you're living life like that, so that your upper teeth are aligned with your lower teeth. Every bite is consistent, chewing, everything. Now, I'm going to use this example to help this make sense, but I want you to do this with me. So try and only move your lower teeth.
Okay.
What are you moving?
Your jaw.
Sorry, not to. But yes, you're right. And that's what you do, Dr. Richard Alex, like that. That's what you're an expert in. And so that's so important. You've got to get that addressed. Now, only move your upper teeth. How do you do that?
Is that a trick question?
It is kind of. I didn't get the answer right. You move your head.
There you
It's
go.
connected to your head.
Yeah.
Right?
It's connected to
My upper teeth now. So it's a strange concept, but regardless, that's yes. You got to get both sides adjusted. Corrected, addressed if there's a problem in that area. And so that's what I'm an expert in, is really making sure the head is balanced over the neck. And so you'll measure just to really help fit that appliance better. And I see it. I mean, at the end of the day, here I always say this, like, this is what you want to remember. Dr. Mystery, Dr. Alex, and then jaw, and then lower teeth, and then NUCCA Chiropractor, head, upper teeth. I don't say myself necessarily. I mean, yeah, you see me, but at the same time, we've got so many NUCCA doctors around the country, whereas you guys are so niche down in what you do. But I hope that makes sense.
Yeah, that makes sense. Now, how do I because up the road from me, I do have a NUCCA, and I have referred patients to him, and I've met with him and talked with him, yet he thinks it's only about him. So what verbiage or how can I open his eyes to say, hey, look, like, we need to collaborate?
So just to clarify, you think that he thinks that he can get the job done without you?
Without me. And it never works. And patients will come back. I don't know why I went to him. He's not helping me at all. But yet I have other chiropractors that I've worked with that whenever, because my patients travel, a couple hours or more away, or they'll put cotton between their teeth and come to see me after they've seen their chiro, and then I make my adjustments to fit. But how do I open up some NUCCA's heads to think like they're not the king of the hill, that there's got to be a couple people on that hill to help these patients? Do you see what I'm saying?
Yeah, I do. There's a couple things that need to be addressed. What's his name? Let's put him on blast. No, I'm just kidding. So
we'll make a rap about him.
Yeah.
Yeah. First question, is he actually getting the job done? So is he sending the pre-X-rays? Is he sending the post-X-rays? Like, if you're not getting results, there's got to be a reason. So, and I always say, am I missing the mark? Like, you tell me. I'm all for constructive feedback. That's how my college coach was. And, he would grab me by the throat and you get it right. Anyway, so don't be afraid to say, hey, like, if I'm, you're missing the mark. And if he gives you backlash on that, you can. And again, all doctors are different. All chiropractors are different. Even some NUCCA doctors are different, which is why I'll kind of touch on like our certification process.
Yeah.
But I will say this at the end of, and I know I was going to talk about this a little bit later, but there's simple tests. Like, for me, I'm doing jaw tests. I'm like, I may not be able to help the jaw clicking. That's your guys' expertise. So, you can do simple tests, pinkies in the ears, open your mouth.
Sure.
Like hearing clicking, like, you need to see Dr. Mystery. And so it's like, has he been educated that these are what you should look for so that, we can make that referral happen? Because in my experience, sometimes the jaw doesn't get better from the neck, and that's okay. We don't necessarily treat TMJ or jaw pain. All we're doing is removing the tension with the expectation that the healing to the jaw is going to improve. The bite has an influence, the upper teeth. So there's still influences. But at the same time, if you're not getting the job done, then you need to look at the target area. So if someone's jaw is not getting better and you're adjusting their neck, well, you need to make that referral. So that's the conversation I'd have.
Okay.
And you probably had this conversation. So there's some doctors that they're so, this is the only thing that you need. And that's just true. And for some people,
I think egos get in the way. A little bit of an ego gets in the way.
I feel like what you're telling me, if he thinks he's like the king of the hill and the star of the show, maybe find someone else. Because I feel like
Oh, I did.
Oh, you did?
Yeah, I did, but it's not another NUCCA. And I really think the importance is a NUCCA. So I kind of had to go to the next best thing, and I'm getting results because I use the NUCCA and then I use a PT and I use meat. But I would like to skinny it down to like one person that my patient has to go to instead of a village,
Yeah.
And with our license, we can't do a lot of that stuff because we're just a dental license.
I know.
We can't.
Yeah, we can't.
Yeah.
Yeah, I mean, I've gotten it. It's like me and Corey, or me and one other upper cervical chiropractor. That's like
Mhm.
depending on if my patient wants to stay in Vancouver or if they live closer to Corey. And so
Mhm.
it's literally they see the two of us and they get the results. So I can understand you wanting to condense it because
Right.
nobody wants to go to
Right.
4 different places or whatever. But
Right.
yeah, it's
Right,
hard.
right.
I know.
I'll touch on this real quick, just the certification process.
Yes, thank you.
And here's the here's at the end of the day, I think the real answer, they've got to be willing to collaborate. So before even I'm all for the certification process, find a good certified doctor. But even if you get someone that's certified and they're not willing to collaborate and work together, that's a red flag. So I
Yeah.
just want to put that out before we talk about the certification process. But yeah, I mean, anytime Dr. Mystery sends me a message, I make it like we've got to talk about patients and making sure they're getting the best of both of us, because I
Agree.
think that lacks in healthcare. People, they come in as a mill, and that's what I would potentially question about maybe this doctor is maybe they're seeing 100 a day and they just really don't have time. Like, oh, we're changing lives, and the ego gets so involved, and I'm not willing to go the extra mile for the patient. And so that's definitely something you want to check in on, even
Mhm.
though it might be
Yeah,
hard.
thanks. Good advice.
Mhm.
But as far as the certification process, here's what this is really all about. And it's, I'll say that it's the most rigorous certification process in all of chiropractic. There's a very high standard that's asked of us. And it really comes down to a few things. And as NUCCA doctors, we believe that the NUCCA x rays and the NUCCA adjustment should be the same doctor to doctor, state to state. So if my patient in Oregon is moving to Washington or Florida, wherever, I know without a doubt that they're getting the same care as what they got in my office. And we want the same standard of care. So, what we've done in NUCCA is create a certification process where I can feel comfortable sending my patients to other doctors when they move. And what this consists of is there's different levels. There's level 1, 2, 3 candidacy, and then there's board certified. And each level has different demands. For example, level 1, you need to be able to take good quality x rays. Level 2, you have to be able to analyze and measure those x rays properly. And then level 3, you've got to be able to show that you can actually adjust and rebalance the head over the neck properly. And then board certification is simply just showing that you can do that 10 times in a row without fail in between, or you're maximizing that alignment as best as the patient can get 10 times in a row. So that's the
And there
standard NUCCA has built, and really how we ensure quality control amongst our own doctors. So that's the other thing is your doctor certified. But anyways, that's
so
the overall idea.
so with that, they're very picky, right? With the X-rays that you submit and the cases you submit, they're like it's like not an easy thing to do. So once you're certified, it's like a big deal. It's like party time.
Wow.
Yeah.
Yeah, which is for the better. At the end of the day, it's all for the patient's benefit, and if
Yeah.
they're critiquing
Totally.
our X-rays, yeah, I mean
Yeah.
that's what it takes to sometimes get these tricky misalignments.
Yeah.
So whenever you're going through that certification, it's not a hands-on. It's like you're sending the x-rays in and you're showing them at a specific,
The proof.
before appointment, after appointment kind of thing. Is that how that goes?
You're absolutely right. Yep, exactly. So
Interesting.
we're instructed to, yeah. So if someone's not necessarily flying, or we don't necessarily get certified at conference, that's where we
Mhm.
train. But as far as to get certified, it's yes, you have to basically send your films that you take, and it's vetted by our standards and certification committee, and
Nice.
it's got to look good. And if it doesn't,
Sure.
and it's funny. There's periods of time where people stop sending because they're just hard, and it's good, because you
Yeah.
have to have that. You got to keep an up high standard.
Yeah. Yeah.
Great.
Let's talk about our lovely patient Kim for a few minutes. Can you tell our listeners a little about the symptoms she came in with, like how she found you? Because she saw you first.
Yeah, it's funny. As Kim came in yesterday,
Oh, she
and it's
did?
crazy. Yeah, it's wild. I know how this podcast works and everything. So she comes in every other month now. And anyways, I told her yesterday. I was like, hey, Kim, guess what I'm doing tomorrow? And she's like, what? And I'm like, I'm going to be on Dr. Mystery's podcast. What
Yeah.
should I tell people? What should I share? And she's like, well, tell them that, you, Dr. Mystery, like, you guys fixed my jaw, my double vision, the dizziness got better, neck pain, jaw, so all the local stuff. And I was like, great, sounds good. And she's like, well, wait, what about, my low back pain and my knee pain? Tell me fix that. And I was like, okay. And then she's like, well, the golf swing. And so she starts talking about all these other parts. And
Yeah.
she's like, I can recover easier. I can, 18 holes is no big deal anymore. And anyway, so, she was like, well, then they might get confused because you're talking about all these other, things that are changing in their body, and that might freak them out, and you're only working on the neck, and, the jaw. And anyway, so she talked about, she's like, well, then you got to tell them about the breaker box example that you told me. And I was like, all right, so real quick, in a nutshell, think of it like this. If you've got the breaker box in your house and it's not working right, how many of the light bulbs in the house will that affect? And the answer is all of them. Right. Now, if the brain can't communicate to the rest of the body due to a traffic jam up there, how many parts of the body will that affect? And the answer is, of course, all of them. Mm-hmm. So that's why we start top of the neck first, right behind the brainstem, really close proximity to that TMJ joint. And so I hope that makes sense. But anyways, to get more into this, I think I had an outline of what I wanted to share. And there was actually another video on this we talked about. But, it's really good because Kim, she's done really well. And she's got a great heart. And I'm just so thankful she was able to get help because, one day she was suffering. Like, I had a video consultation with her and she was telling me about just all her pain. She was just all stressed out, her jaw. She couldn't even open her mouth. 1-2 inches, Dr. Mystery checked this, but she fixed that. I mean, so I was like, bravo. Yeah, it's like 2 finger widths, and then bam, with it. And some people do take a little bit more time, but she just breezed through. And I know Dr. Mystery will touch on this. But it's like she got wonderful results from this. But I brought her in and I tested her, and she's all crooked and bad posture. It was in rough shape. It really was. I took some X-rays of her head, of her neck, measured them. I got her adjusted. The upper teeth, we balanced them out with the lower teeth, and then of course to support that, you've got to have those appliances. And then immediately she went over to see Dr. Mystery to get that fitted. And I'll let you talk about that. But yeah, I mean, people think like, oh, there's this massive process that's involved, but no, it's really simple. And you check the neck, you check the jaw, you have a solution, and it's a triple win. And so upper teeth aligned with the lower teeth, jaw line, neck line, it's wonderful.
So how did you guys coordinate appointments? Like, did you go back to back, like see Priya, see me? How did you do that?
Yeah, we have at least a 24-hour rule. So if I adjust them, I don't want them chewing food. I don't want them eating lunch. I don't want them talking too much after I work on them. But the idea is rebalance the head, and then boom, you can use the cotton, put it in the back so they're not chewing. And then ideally you'd get right over to Dr. Mystery.
Yeah.
If not, just be careful, protect the neck. Don't let those neck muscles go into spasm, or the jaw if you were waiting an extra day, because, and I'm telling you, Dr. Mystery has so many people that fly in to see her. So sometimes it works like this, but sometimes, they do need to stay in a hotel and go the next day. And so we make it work, but at the end of the day, the sooner the better. But yeah, 24 hours should be good enough time. But that's where she, refines the appliance, and she works her magic, and it's great.
Yeah. I think Kim really got a lot of relief, and I think she flew through treatment so fast because she actually had her neck taken care of. She was in alignment when she came to see me, when I started taking her records, and I think that was huge for her. She went to you first, Corey, and she said that you took care of her double vision like right away. Like, so by the time she came to see me, because she couldn't get in, apparently, I think my schedule was really backed up, that some things were already taken care of. So I feel like that really helped my treatment go much faster.
Sure.
Yeah, she just flew through it.
So tell me about her double vision. Did she have double vision, like looking straight on, looking to the side, and it came double vision? Like, what kind of double vision did she have? And what do you correlate her double vision to?
Yeah, a mystery. because it got better, I didn't really dive in deeper to it of like, all right, what's going on with the science, the neurology. But here's the thing, I'll say this. I mean, she would look and she would see, I mean, one eye would be looking this way, the other, so they wouldn't track right. And
Okay.
in my experience, right, hey, let's clear out that traffic jam, see what happens to the eye, see what happens to the jaw. If that double vision didn't get better, that's where, hey, I've got a great neuro-optometrist that I refer to, Dr. Maxim Lee. But anyways, like that's kind of the route that I go to, and he's going to be the expert in how that connection is with the eyes, the double vision. So
Mhm.
again, back to the concept, like I don't really necessarily treat double vision. I mean, I ask for it,
Sure,
just like
sure.
TMJ. I ask for it on the form, and I'm like, hey, I'm really hoping this gets better, and we can justify some of the science. But with the eyes, I mean, I won't get into all this, but you've got the cranial nerves. They get deformed with a misalignment, so they're still going to 4 and 6 lateral rectus. So there's definitely an impact that can happen at the neurological level near the brainstem. But that's pretty much all I'll really talk to them about. But yeah, does that kind of answer your question? Cranial nerves.
Yeah. So, with just going to the double vision too, do you do anything with the sphenoid bone where you have some of those nerves and the ophthalmic arteries and stuff coming through? Do you adjust up in the sphenoid, or you just the neck?
I'm just the neck. I
Okay.
have seen patients go through that. Are you referring to that balloon adjustment?
No,
There's
not
certain,
the nasal ballooning. No,
that's not
not
okay.
that.
I've seen certain people do that
Just
for the sphenoid.
yeah,
But as
yeah.
far as, yeah, I really don't go into that area
Okay.
um, just because it's not necessarily the atlas vertebra. That's where we're,
Right.
as NUCCA doctors, more trained in. So we just don't really have the training about adjusting the sphenoid bone, but I'm sure it can have an impact.
Yeah.
Mhm, mhm. And what are some of the main symptoms you treat, Corey? Like, what do patients come to you with? Like, if you had to name like the top 3 or the top 5, like, what do you see most?
Yeah, it's the migraine headache. Why? Because we find that, and we've got studies to actually show this one, where if you have a counter rotation of C1, C2, so if C1's going this way and C2 underneath it's going the opposite way, really can lead to neurological compromise, vascular compromise, blood flow. There's a lot we're learning with the eyes. Again, double vision. What's the connection? We're still getting that figured out, but eyes not tracking right can lead to migraine. So, anyways, the migraine headache does really well if we can unravel some of that counter rotation. And then neck pain, of course, that's pretty standard. Just again, misalignment, neck muscles going to spasm over time. It's going to lead to fatigue and potentially pain. And then I know this sounds a little radical here, but hip pain, that, even more so than some of the jaw stuff. I mean, jaws do good, but hip pain really does better because what we see is
Mhm.
where the head goes, the tail will follow. And it's really an interesting concept to see what the paraspinal muscles do when they'll compensate and really start tilting the hip. And then
Yeah.
over time, you're walking every day, running, especially for my marathon runners. It's incredible to just see. Anyways, but I'd say those are the top 3.
Yeah. That's really interesting, and it's all with the top block. Let me ask you something too, because I've heard of a AO
Yeah.
chiropractors that just deal with the way up,
Mm-hmm.
Atlas
and
orthogonal.
nano-occipital. So, and I've worked with some of those, or
Yep.
one of those in my area. We don't have a lot. I have one that I've worked with, and we've found good results with that. So, is it, and it's always very gentle, the manipulation. And
Mhm.
that's one thing I always stress, especially to my out of town patients that want to go to their chiropractor. I'm like, okay, but how do they do it? Is it a snap,
Yeah.
crackle, pop? Because if it is, I'm not on board at all. And usually I'll have a conversation or two, and I have them stay away from the neck, because we have studies that show too, once the jaw is in alignment, then the neck will follow.
Mm-hmm.
But what's the difference between you and an AO other than positioning and where you're treating?
Yeah, I love Atlas orthogonal. There's advanced orthogonal. There's Epic. So there's kind of a spinoff. But what these techniques use is a sound wave instrument. So instead of using the hand adjustment, which is this part of
Mhm.
my hand, gentle pressure, they're using an instrument to move the Atlas vertebra underneath the skull. And I think it's wonderful. If I can't find a NUCCA doctor, the first one I'm looking to is going to be an Atlas orthogonal, advanced orthogonal, or Epic practitioner. Why? Because less is more. Lighter's righter. You're not getting a big thrust into the neck, and we'll keep it here. But I've had all upper cervical adjustments, and there's only two I would ever let anyone do on me in the future, and that's going to be the instrument or NUCCA, just out of sheer the force. So the force production. There's other ones out there, but like you said, some of them are very thrustful, which people respond well. But for me, they didn't. For my mother, they didn't. And so I've got to be comfortable, be able to do an adjustment to my mother. That's just one of the core ideas that I have. But here's the reason why I ended up going with NUCCA over Atlas orthogonal is because I got feedback when I use NUCCA. There's something about applying tension pressure to the person's Atlas, and I never knew when I was done with the Atlas orthogonal. So typically, if you go to an Atlas orthogonal, you're going to hear one click, which is the sound wave impulse, and that's usually where they'll stop. So that's one of the reasons with NUCCA and the board certification process is like, well, try and chase that down a little bit. If your Atlas is tilted up 5 degrees and you get an adjustment and stop at 3, well, try going a little bit more. And the only people that were doing that were NUCCA. Now, I'm not saying just force it down and try to jam up the joint. No, but at least go a little bit more, rework the angles just to see if you can get more movement to, again, rebalance the teeth, to clear out the nerve tension. So I hope I'm not sounding confusing here.
No.
I'd say the primary, the standard, the x-ray standard's very similar. So pre and post x-rays. But I think the biggest thing for me was I found that valuable feedback is I knew when I was done adjusting that patient, because I'll feel that joint kind of lock out and it'll kind of push me back. It's hard to explain, just like trying to ask a golfer, when you make contact with that swing, or a baseball player, you just know where it's going the minute it hits that metal.
Sure.
And so it's very similar ontological experience of when you're adjusting a patient. You just know doing 7,000 adjustments, like you get that feedback over time.
Yeah.
That's cool. That's really cool. I never even thought of it like that. But I mean, I guess as dentists, we sort of do the same thing when we're doing root canals. Like you can really feel, it's more about feeling than seeing. Yeah, you can feel it, right? And so, wow. Yeah, I didn't even think about that. So, well, let's see. So Corey, I refer a lot of patients to you, like when they're locked or they're not recovering as quickly as expected. They've got neck pain. One leg is shorter than the other. Their head is tilted. It's rotated. Or I look at my CT scan and it shows me discrepancies with their upper cervical vertebrae. So like I look for certain things and I sort of know when, hey, you know what, this is a good time to see Dr. Burt. When do you refer patients to me, or like what do you look for to, and then say like, hey, it might be a good idea to see Dr. Mystery? Like what signs or symptoms?
Yeah, great question. I think this will be valuable for a lot of other health practitioners that are watching this, or even other chiropractors, because the first thing, the easiest thing you can do is just screen for it. Screen for TMJD, ask it on your intake form. So if patients check that box or check a jaw pain box, like boom, I'm automatically thinking, all right, Dr. Mystery, we've got to bring this up at some point, sooner, better than later. And so there also, there's a simple test that I do and on all my patients, and I kind of went through it earlier, but it's like, if I'm seeing that box checked, you got to look at the jaw. There's no other way around it. And the patients respect that. Even though they're coming for the neck, I'll mention the jaw, because they're like, oh yeah, usually, my jaw does this. And so you can teach this to anyone, but it's so simple. All I say is, hey, John, put your pinkies in your ears, press forward, and then open your mouth. And you'll feel that condyle push up on your pinky, and sometimes you'll hear it click or pop, or it might be painful. So that's called intra-auricular sensitivity. That's a referral to Dr. Mystery. And I say, hey, that's painful, isn't it? And you need to go see Dr. Mystery for that. And so we talk about that. Again, we walk through the process of like, hey, this is, at the end of the day, this needs to get addressed. And that clicking is likely not going to go. It might, but it's not likely, because that's your wheelhouse. That's something going on with the lower teeth, the jaw, that needs to be addressed. So simple test. Another simple test, just, hey, open your mouth and watch how their jaw tracks. If you see a big clunk, and it's going around, clearly lower jaw's not right. You need to get that looked at, because I guarantee you, if someone opens their mouth, their muscles in the jaw are going to be in spasm. You need to recapture that disc and balance those masseter muscles, temporalis. And so that's something that, again, I'll do, and it's really important that everybody does it. And again, the patients love it. They really think you're more thorough, even though you're just there for the neck sometimes. What else? Sometimes patients will come in with records, and I'll see their MRI, and I'll see jaw MRI, and automatically I'm thinking, okay, Dr. Mystery. And I'm not an expert at reading jaw MRIs, but she is, and you are as well. And so that's where I'm like, you want a second opinion about this. Even just the other month, I had a patient that was ready to sign up for jaw surgery, and I really wasn't in like the loop on it, because sometimes they think the jaw is unrelated and it's my communication that needs to get better. But I'm just like, hold on here. You need to go get a second opinion first, Dr. Mister. It's like, that's what you do.
I know.
And so I kind of was like, no, maybe, but not likely. And so that's where I'm like, here's the note, let's get you connected. And I'll tell you, and you can talk to this, but I really do believe that you guys are saving people from jaw surgery, because I've seen it done more times than not. There's no going back. So I'll just leave it at that. Again, you're more of an expert to speak on that. But I think that's some of the primary things that I'm looking for. Like, boom, when is Dr. Mystery popping into my mind, and what needs to happen to get these jaws corrected?
Yeah, that's interesting. So I know with my office here in Pittsburgh, and I have a rental spot next to my office that someone else, and I'm like, I want to kick them out of there, because I think, it'd be interesting and worthwhile, or, to have a center of a TMJ dentist and a PT and a chiropractor. And do you think there's value in that for a patient? What are your thoughts?
Yeah, I think you said it. I think, the three of us, PT, neuromuscular dentist, and NUCCA, and it could, there's good chiropractor, right? So those three should be able to get someone 90% there. I truly do believe that. And I think that the order does matter, because here's what I found, and I love physical therapy, I really do. But I've found that if they start with physical therapy and their jaw's all crooked, their head's all crooked, muscles are in spasm, this makes zero sense. Because if all that's happening and you're working the muscles and you're doing all these, exercises, and it's just going to grind down the joint even more. And so it's just not logical to do that. Think of it like this. It's like racing a car. You race it when it's in alignment, just like you exercise the body when it's in alignment, because you don't want muscle spasms that are going to fight with you. So I think the best possible outcome is you got to get the alignment figured out, upper teeth, get the alignment figured out, lower teeth, get that appliance, and then and this is my sweet spot that I found, and I've spoken to other colleagues about this, 4 to 6 weeks, start doing that PT. Why 4 to 6 weeks? In our experience, it's because if you start PT too early, those upper neck ligaments have not had time to stabilize and strengthen yet. And it takes time for those to strengthen, so that now we can start exercising. Because here's what I see, and I've tested this. I'll give patients exercises sometimes early, because they're like, I need to be doing something. What do I need to do? I'm like, all right, do these exercises. And they don't hold their alignments as well, because what happens is that the muscles are actually tugging on the atlas. Ligaments aren't stable yet, and they just pull it right back out into the nerve, C2, and it's going to cause compensation. So then I'll end up readjusting them, because that's the idea in at least my world, is I'm actually not trying to adjust them. So once they've held and maintained their proper alignment from the previous alignment, then I'm much more confident that you can do PT and strengthen those.
Well, let me ask you this. What about massage?
Yeah. I'm 50-50 on this. So
I know. It's an interesting one, because my patients tell me, they're like, well, Dr. Burt said maybe don't get massage. I'm like, okay, then don't get massage. Because I don't feel strongly one way or the other. So,
okay. I say let's test it, because I've had patients go get a massage And I've tested it pre and post. So, hey, go get a massage before you get adjusted, get it after you get adjusted. And half of them flare up and they come back and they're all crooked again. And I'm like, well, so there's so many variables with
I
massage. Sorry, let's start
know. I
there. I mean,
know.
some of them are digging into the upper
I
necks,
know.
they're digging into the levator, the platysma, like all these muscles are like, so could that cause just the nerve system to go, whoa, too much, lock up, and then boom, there
Yeah.
goes C1, or boom, there
Yeah.
goes the masseters
Good
into the,
point.
pulling the jaw one way. So there's definitely that. Anyways, to wrap this up, though, I would say 50-50. You got to test it. Some patients do well and are fine. Some patients, it flares them up. So if that happens, I say, okay, one of two things. It's too early, or so let's try it again. But if we try it again when they're more stable, then like that's how I am. Honestly, I flare up with massage and I don't hold my alignment as well when I'm getting my levators worked on. So there's
Yeah.
different misalignments, there's different tensions. So there's so many variables, but I say you got to test it per person.
Yeah.
And even with PT, some patients do fine with
Yeah.
PT and they get great results and they haven't seen us. So how do you explain that? So at
Yeah.
the end of the day, I we do our best tracking these
Yeah.
things. But,
And at the end of the day, we can't always explain everything.
Yeah. Yeah.
absolutely.
What about trigger point injections?
Okay.
So sometimes, you can feel sometimes in their traps, oh my God, they're so tight. And I did trigger points just yesterday, but I don't typically really do that unless I'm just trying to get like a relief for a little bit of time. And it might last a day or two, or even sometimes only a few hours. But what do you think about those as just something to kind of hold them? But do you
Mhm.
ever utilize that with NUCCA?
I think there's a time and a place.
Mm-hmm.
I think so typically in my experience, patients, and I'll refer them out for naturopaths and they'll do those lidocaine injections, which are trigger point. And if the levator scapula is tight, I've got to ask why. Why is it tight? Is it a neurological reaction? Is it because the bone's doing this, the jaw's doing this? What's going on? So if the brain is tightening that levator for a reason, do we want to interfere with that? Do we want to just go and say, all right, let's put this in and hope that it relaxes? That's an option, but my philosophy says that if the brain's tightening that muscle, it's doing it for a reason. So if you relax that muscle with an injection, is it helping? Or is the brain going to get more pissed off and just go, all right, now we're going to tighten it up again? So that's where I'd say you can try it. But if it tightens it back up again, then your body didn't like it, the brain didn't like it, and you got to get there's a different cause. So that's still an outside in approach where I'd say, you observe the muscle and you say, let's inject it, let's get it to relax and hope that that relieves pain. So it's more pain management. And that's where I'd say there's a time and place for it. If we're getting the jaw worked out, you're getting the neck worked out, and we're still not making progress, then the lidocaine might be okay just to help you get through the day. And so there's definitely a time and a place for that. But at the end of the day, you got to ask the question, why is that muscle tight?
Right.
Yeah. Yeah.
Right. Good. That's a good answer. So, how quickly do you see results from your treatment, and how long are they typically in treatment? Like a lot of people are like, I go to my chiropractor twice a week, and I've been doing that for 12 years. I mean, what's your typical?
Well, I would ask that patient and chiropractor, why aren't they holding their adjustments? Because
Right.
twice a week, I mean, you might start with that, and I do start with that, but that they should graduate within a few weeks to a month. And if I don't see that, I'm messing up. I'm rescanning them for free, and I'm like, let's get this figured out because they need to at least start holding and maintaining their alignment. So that's a concept I want to talk about. But relief's a whole other question. I've seen patients get relief after one adjustment. Obviously, everyone's different. There's more severe misalignments compared to others. So yes, we know there's more factors. But if you're going to a NUCCA chiropractor, AO chiropractor, upper cervical chiropractor, and you're not getting relief after 30 days of seeing them for kind of your primary concern, then something's not right. And you've got to dive deeper into at least making sure it's getting right, or looking at the concern, the target area, whether that be the jaw, the hip, whatever it is. And you got to get that figured out. But with NUCCA, the goal is to get checked 6 times a year. And so every other month, get in, make sure the alignment is stable, make sure the head's on straight, make sure the nerves are relaxed, muscles are relaxed, balanced, and that way your brain's healing, your body's healing. Now, sometimes you'll get an adjustment at this visit, and sometimes you actually won't. And so that's the model shift for people. Like, why would I go to the chiropractor and actually not get adjusted? And the concept is, we would rather, the hardest part of our job is to knowing when to back off.
I know.
Because the educated brain says, adjust. Oh, you got soreness? Yes. Let's adjust. And in my honest opinion, people are over adjusted in this industry. So that's where you got to be careful. If it's not, I mean, it might work, go twice a week for a month, but if you got to figure out the other reasons.
Sure.
So the hardest part is knowing when to back off. So that's where, hey, I'll get checked 6 times a year and I might get adjusted 2 out of the 6. Mm-hmm. And so just like, you go to the dentist, get your teeth checked. Sometimes you might need a filling, or sometimes you're fine. See you later. So that's the idea. You're getting checked and measured with the expectation you don't want to get an adjustment. Now, at first, yes, it's more common. So not getting into some of the recommendations, yes, we'll start it twice a week, but then they graduate as they maintain their alignment. So that's what we're looking for. And when people have been in alignment for a long time, they'll feel it. They'll feel like they're starting to slip. Some indicators show up. Sometimes it's not necessarily pain, but people know when they start losing their alignment, and they can call in. But I've had patients adjust. There's sometimes twice a year I'm adjusting someone. Sometimes it's more frequent. So many variables. But less is more. Just overall philosophy. Yeah.
So I have another question for you. So I have patients that I do ortho on, and they have cranial strains, like their ears are coming forward, or they have cranial strains and side bends. And how have you worked with like orthodontists or people that are moving teeth, expanding palates, and also NUCCA? Do you do any of that kind of work?
I don't do that type of work. There's other people that send me patients that do palate expanders, and there's this doctor that does this laser he's an airway guy. So as far as like ortho work, and sometimes you get like a torticollis where the head is so locked up. I mean, we do the most we can. So going back to trigger point, right? If you're working on, they're still like this, you gotta be able to try and break through that to get those upper teeth aligned up with the lower teeth. Mm-hmm. So I would say this. I mean, the concept doesn't change. You want to remove the traffic jam up here to let the body, let the joint do its thing, and then just evaluate it. All right, what improved, what didn't, and that's the idea. I think it's a great start, but in the case that we're missing the mark, or maybe the patient's not getting the results they're looking for, then yes, you got to look. Let's look at the palate. Let's look at the ear. Let's look at the sphenoid, right? So some of these other bones that get addressed. But usually, that's more in the dental field rather than the chiropractic field, at least in my experience. I think there might be some specialists out there. But as far as treatment,
that's what I'm looking for. So if anybody's out there and that kind of specialist in Pittsburgh, I need you.
It's up and coming though.
Yeah.
That's good to hear. I'm lucky I've got Dr. Burt here and my Atlas orthogonal one across the street. I'm a lucky girl over here.
You are.
Yeah. Well, thank you so much for joining us, Dr. Burt. This was so informative. I think our viewers, our listeners are just going to love this episode. Thank you.
Yeah, I'm excited to see it come out. And again, appreciate so much the opportunity and the work you're doing. And thankful to meet Alex too, way on the east side.
Nice to meet you. And good luck with everything. And I can't wait to see that video you made.
I'm sending it like now. I'm going to send it.
All right.
Good times.
Okay, thank you.
Thanks to our wonderful listeners too.
Yes. Have a great week, everybody.
All right. Bye, everyone.